What are the opportunities for a student who has taken PSM as their PG subject?
For example, I'm telling if you are getting in a very good college and if you are interested in the subject, close your eyes and take this subject.
What are the pros of taking PSM as their future subject and what are the cons of this particular branch?
Pros of PSM, the diverse opportunities. Cons of PSM, there is less charm in the subject.
What are the best fellowships possible for a PGSR?
Go for yes, that will be the best opportunities because
in the work culture, what is the core difference between MD and an MPH?
so work culture, once you are entering into the team, it's almost same. It's depend on the projects and what you are working for.
Key parameters a student should look at before choosing a college.
First and foremost, for PSM or any other pre-paraclinical subjects, the city is very important. Metro city is what I ask.
Boss, how much can an MD PSM earn? We are on a mission. The mission to build India's largest community of doctors. And to actually help me out, all I need from each one of you is help me find the best guest who can enlighten us with their knowledge and help us build this community. Today, on a very huge demand, I have got the best person to do so. He's going to talk about one of the most underrated subjects. It can be confused between a clinical and a non-clinical subjects. It is considered one of the most boring subjects in the whole medical curriculum. And to clear all the myths around this subject, we have invited Dr. Rajeev Shetty, sir. He is a renowned educator, an MD PSM from Maulana Azad Medical College, one of the most premium institutes of our country. He has a teaching career of almost 13 years. Has taught in DAMS, has taught in Bhatia, has taught in E-Gurukul, multiple accolades. He is going to clear every myth about PSM for us. So let's put our hands together and with a huge round of applause, let's welcome Dr. Rajeev Shetty, sir. Welcome, sir, to the Nachiket Bhatia Show.
Thank you so much, sir. Like it's the first show which I'm taking here. I'm really excited for this. Sure.
So PSM was a big demand from our students because I think PSM is such a branch which has a lot of gray area.
Yeah.
People want to take that branch, but they have so many apprehensions.
Yes.
So today, the main purpose of inviting such a legendary guest to our show is so that our students get a clarity what exactly is PSM. So before we move on to that subject, let's start with Dr. Rajeev Shetty. What was the beginning of Dr. Rajeev Shetty? How and why did you choose MBBS? And why did you choose to become an educator?
Yes.
All yours, sir.
First of all, from the school days, like as a small kid, everyone is excited about sports. So I was into cricket in the primary school part. Like in the high school, again, the parents will come into the picture and they wanted me to become a doctor. So again, yes, I was scoring good. I entered the residential school. I stayed there and I got an MBBS seat in Mysore Medical College. So I did my UG from Mysore Medical College. Then again in the internship time, again I was more towards teaching because I'm from a family of teachers. So I'm more into teaching and I was focused towards that most of the times. And then when I got PG in Delhi, yes, then I took this PSM as the subject. Then I entered first year. Then I was focused more into the teaching part. Then in the second year, when I started teaching, I started teaching from FMG batch only. Then I was in the third year when I started, at the end of the third year, I started for NEET students. So like this, I'm enjoying this profession because from the family of teachers, I'm carrying this legacy towards. So that's the main thing. I'm blessed to be a teacher. All for sure.
That's great to know, sir. You have been a teacher for long now, I think more than 10 years.
12, 13 years.
Yes. Sir, I know you got a great rank in your NEET PG at that time. Yeah. I think it was All India PG at that time.
Yeah, PG.
You were getting multiple branches. Why did you choose PSM specifically?
Sir, like during my preparation days, like I didn't attend any coaching. So just I was there in my reading room, reading because my ambition was very less because I wanted to take something which I can get into my teaching because that was the only option left for me. Sometimes what we say is having no option is the best option. So I was into teaching and I wanted pharmacology actually. So my All India rank was 1900 and then the confusion will start. See, everyone around me will tell, go for clinicals, why not DMRD or radiology, why not dermatology? And that confusion will start creeping in. And it's not the endogenous things which happens, it's always the exogenous factors which will influence your career most of the times. And my family, both are teachers, and they don't know much about this field. But most of the times, my teachers, those who are around me, wanted me to take dermatology. But still, there was one thing which was making me to take this teaching. It was my strength. Always we need to back our instinct, back our strengths. So because if I take clinical, it will take time for me to settle down, and I wanted to settle as fast as possible. So better back my strengths. So then I came into this field. Why in the counseling session, if I went to Chennai, just still I remember, when I took pharmacology, the seat went at 600, I think. I wanted the rank, I wanted to take in MAMC only. Pharmacology, there was only one seat in AIPG and one student took at 600 rank. Then I was totally confused. I was thinking what's left for me. Then I thought, yes, PSM. That was the moment when I thought, yes, PSM. Then because there was a lot of scope in teaching in this subject, because it's less charm, the student seems like it's boring subjects. So it's a sort of an adventure for me to take this subject. And then when I took PSM, the counselor was shocked and the students around me were telling, PSM at 1900. But I wanted MAMC and I wanted pharma. I didn't get pharma. I took PSM. My senior took dermatology next to me and he was thanking me. Thank you so much. And even I was thanking my God. Thank God. At least I got the subject of my choice. It was win-win for both of us. This is how I entered this and I'm going through this and I'm really loving this subject.
So you basically left dermatology and chose PSM.
Maybe because I wanted to back my strength, yes. Dermatology.
That's a very gutsy move.
Yeah. First round, maybe in the next round I would have got radiology also. But still, I want to back my strength and instincts. Most of the times I will go with my instincts only, rather than what the people say around me. That is not the thing.
I think that's a very good message for our students. Because so many times they're under the pressure of, their peers.
Parents also,
Yes.
sometimes, most of the times it starts from the family only, then comes the peers, then comes the teachers around them. Then most of them, they stop talking to me just because I took PSM against their advices. But now they keep on calling me, where are you? Please come and meet me once in Mysore. Things will change, sir. It's not that the only thing what you should know is what you are doing, that is very important. Orientation, time, place, person will be having that vision, and maybe sometimes it can click, sometimes it's not. It's about the risk reward what you are taking most of the times.
So I can see that you're crazy about MAMC.
Yeah, MAMC. I wanted only MAMC. That's because it's the top college in AIPG. So I wanted to take one seat in that college. Maybe whatever I was supposed to get. I didn't get pharma. I took PSM.
So what would you say sets MAMC apart from all the other colleges of this country?
So MAMC, first of all, it's in Delhi, the capital city. That's where it starts everything. Like for South Indian students like us, Delhi is something. Matlab, I don't know what I cannot describe. Only when you come to Delhi, you'll understand. And that's the first thing what is important in MAMC, it's Delhi. And the second thing is, most of the times, like we think about the stipend part also. And the stipend is very good in Delhi, and especially in MAMC, it's slightly higher. And the teaching, when I entered the department, especially I'm talking about PSM department, the toxicity is almost zero. They will listen to you, what they will say, and what you are saying, they will listen to you, and their inputs is also very good. And when they talk to us, it's about mutual respect. That is the first thing which I liked in the teachers as of now. And rest, everything, the department and the postings, it's not that hectic also. Sometimes these things will also matter a lot when you're entering in the PG times, because you're into a new city, new college. The teachers will be the guardians for you, and if they are very much helpful, you'll feel that the environment is supportive. Sometimes that is very, very important for someone coming from a South India to Delhi and staying in this place. You need that working environment to be supportive. So that is the main reason why MAMC, I think, slightly better. Anyhow, the name is there, but the thing is, the reality should be more important, and the department is very less toxic, and the faculties are very much supportive. So.
And between AIIMS and MAMC, AIIMS Delhi and MAMC, if you have to choose based upon the academics, based upon the field work, what would be your choice?
A very difficult decision because AIIMS INI-CET exam, MAMC APG or NEET PG exam, that is the first thing. And if you get a rank in NEET exam, better go for MAMC. That is the first thing. If you get a rank in INI-CET, prefer Delhi AIIMS. And again, when I'm comparing academically, it is almost same, I think. But the clinical exposure is slightly more in AIIMS. And the academic exposure is slightly more in MAMC, what I feel, as per the research what I have done. But clinical exposure, yes, AIIMS is slightly better than compared to MAMC. But the toxicity, work culture, MAMC will be slightly higher than AIIMS. Overall, it will balance out most of the times. If you want me to take MAMC, AIIMS, it's very difficult for me to select in between them, and I don't want to comment also, sir.
So let's talk about the apprehensions and the questions that our students have in their mind currently. NEET PG counseling is going on. The first question every student asks me about PSM is that a good branch? People consider it clinical, some people consider it non-clinical. How would you describe this branch?
Sir, PSM full form, Preventive and Social Medicine. One is about prevention. The second will be with the society. The third, there is clinical touch. Obviously, there will be clinicals in the sense not deep. It's just superficial, OPD basis. Yes, you'll be having MCH, immunization, delivery facilities. You can treat the patient on OPD basis. So it's, yes, clinical subject, not a paraclinical or non-clinical subjects. It's purely a clinical subject, sir.
And how would you say, what are the pros of taking PSM as their future subject and what are the cons of this particular branch?
Sir, PSM, first let me tell about the pros of PSM. Yes, first thing in PSM is the diverse opportunities. We'll be discussing it later. The diverse opportunities, it's not just the thing in the most of the students will be having this notion that when you take PSM, you'll be settling in the medical college. That's not the thing. There are so many diverse opportunities. We'll be discussing it further. And the second thing is, after main thing is students will be asking, sir, whether I'll get my time when I take PSM or not. Compared to clinical subjects, yes, you'll be getting lots of time. You'll be getting time for your family, and yes, personal time and the family time will be enjoying, and you'll be putting that time into the extracurricular activities, whatever you'll be putting. And no emergencies. Nobody will be calling you in the night. Yes, it's just OPD. If you're opening a clinic also, it's just OPD base. And then if you like traveling, you'll be traveling into the remote places. You'll be working for the projects. You will be going for international meetings also. So all these are main pros of PSM. Like you'll be having diverse opportunities, you'll be getting time, you'll be loving, like if you love traveling, you'll be traveling to different places. And main thing, you'll be in the society. You'll be feeling that you'll be doing something for the society. Like prevention part, when you'll be working with the NGOs or working with the projects, you'll be direct in contact with the community. As we also say it as a community medicine, you'll be direct in touch with the community. So these are all the main pros of PSM. And anyhow, pros, you can take it as a decent income also. You'll be getting the decent income. It's not that very high or very less. You'll be getting the decent income so that you'll be having time and the decent standard of living. Coming to the cons of PSM, very important. I wanted to focus on this because there is less charm in the subject. The less charm starts from the textbook itself. The park is black and white. When the students read this subject, the first thing what they tell is, sir, what is this subject all about? Because they don't have any colored images. First of all, they don't have any colored images. Second thing, when they read the entomology part or when the teachers are teaching something practically, they'll be thinking, sir, whether it is a subject what a doctor should know or not. That questions will come and there is very less charm in the subject. So this charm will lead to some amount of stigma. Usually students, when they say, sir, I'm taking PG CET, the people around them will tell, why PSM? Because very less exposure, maybe that is creating less charm and that is creating some doubt in those who are taking PSM. And first of all, the cons is if you are taking PSM, there is less clinical exposure in the sense you are not going into the depth. If you are loving emergencies, if you are loving casualties, this is not the subject. And if you want more adrenaline, if you want to do something like, I want some adrenaline rush, I want to do some surgeries, I want some emergencies, I want to do some like life-saving surgeries and all, or life-saving procedures and all, this is not the subject. It's just clinical, yes, but not going into the deep. That may be one of the cons of this subject, yes, sir.
Boss, you were talking about the opportunities of this subject. Now, that's a true apprehension in our students because, PSM is not which is something talked in glory. It is always
yeah.
talked about that this branch is limited to the college itself.
Less charm,
And
yeah.
even if you think about it, that's the only
That's the
branch
only
which is basically, even in your college days,
Yeah.
you have to come to college instead of going to the hospital.
yes.
Rest everything
Yeah,
is in the hospital
yes,
itself.
yes.
Now, what are the opportunities for a student who has taken PSM as their PG subject?
Sir, as a postgraduate, if you're taking PSM, the first thing what matters is the college. You have to take PSM in a very good college. For example, I'm telling if you're getting in a very good college and if you are interested in the subject, close your eyes and take this subject. Means very good college. Or a decent enough college, if you're taking it, yes, if you're taking this seat in the PG time, you have to balance it out. Either you are doing some fellowships in research, analytics, or whatever, you'll be balancing out. So that thing can balance out. Or the third thing, if you're getting BSM in a peripheral college, something like in the remote settings, better don't take this. So college matters, CV matters, and once you are talking about the opportunities of this subject, the first thing what I will be telling is academics. Academics means medical colleges, teaching. You'll be entering the teaching, yes, in India as MD, PSM, then you'll be doing SR-ship, then you'll be going into assistant professor, that hierarchy will be there. No, sir, I want to teach in other countries. Yes, you have to do Master of Public Health. You'll be getting opportunities in other countries as a teacher, as a tutor. So this is for academics. The second part is as an epidemiologist, you'll be having an opportunity to work for national institutes. Like we are having NCDC in Delhi, National Center for Disease Control, National Institute of Health and Family Welfare. There you'll be getting the jobs as an epidemiologist, so you can work for government projects. Then comes the development sector. You will be having NGOs, you can work for their projects, you can come and you can get their projects, you can work towards them as an epidemiologist or as a director of that NGO. Then comes this clinical thing, especially, or the industry part also, sir. You can work as a scientist in vaccine industries or pharmaceutical industries. They need scientists, they need a PSM person, so that you'll be taking care of all the research oriented things, the clinical oriented things. So vaccine industry and pharmaceutical industry. Then last one more thing is what my senior and one of my batchmates has done is they have done fellowships in diabetes or some OPD based, and they're working in the corporate settings also. It's a time like 9 to 5 job, and they can work clinically. Obviously, you can have that separate clinics, separate if you're well versed in diabetes or some basic arthritis related fellowships, or you can enter into an administrative job. The projects need an administrator. You can do MBAs, and these are all the main things like academics, epidemiologist, research analyst. Then comes the teaching job, what I already told, industries. Then at last you can go to the clinical part also on an OPD basis. Yes, there are my seniors and batchmates working in corporate hospitals also on OPD basis. They have their separate clinic and they'll be seeing the patients. These are the main things like opportunities wise.
Perfect, boss.
Yes.
But there's a major opportunity with United Nations as well.
International
Now, is that
organization. Yes, sir, sure. International organization, you can work for WHO, you can work for United Nations. But the thing is, getting into that needs some proper background homework. Like for example, you're having your degree, MD. If you are having that fellowships related to research, analytics part, then the language is very, very important. You will be learning some languages like French, Spanish. These things will help. So this will get your CV ready. So that means from your side you are ready, and the WHO keeps calling you. Like they'll be having their own separate websites, and they keep calling you related to any other jobs, whatever they're like. If they're putting any projects into our country, they need some PSM experts, so they'll be calling you. And then when they call you, you'll be applying their job and they'll be calling you for the interview. And depends. First of all, it's the contractual part. It's not permanent jobs what they're giving. 1 year, 2 year, that job. And they'll be seeing how you're working. Obviously, it happens in every setting. And when you're working on a contractual basis, depending on the projects, depending on your work ethics or whatever, and you'll be going to the hierarchy, next. And sometime my junior is working there in WHO. Maybe last year he went into WHO, is working in Geneva. And yes, all this CV matters, college matters, your work matters, research, language part also matters. And the next thing is, some people, they keep telling me, yes, whether the influence matters. Maybe yes, because everyone is competing, and their main aim, most of the times when the student asks, sir, I'm taking PG, PSM, will I get into WHO directly? If you're aiming to WHO, maybe sometimes, like, it's getting into the team, cricket team also, you need some, whatever you can tell, the influence part also. Yes, that also matters a lot. I mean to tell this. Yes.
So, sir, what are the super specialization possibilities in this branch?
The super specialization as such, there is nothing like in PSM. It's all about the fellowships, what you'll be doing, research part, analytics part. And the next thing is, like, if you want to work outside, as I told, it's Master of Public Health. So because that will help in getting the CV ready, so that you'll be working for international organizations. Yes, after MD PSM, you can do MPH and other fellowships also, as per research, analytics, or administration job also.
What are the best fellowships possible for a PGSR?
So fellowships as of now is diabetes. If you want to do a fellowships, go for diabetes. Yes, that will be the best opportunities, because practically I'm speaking, as per the research what I've done from the batchmates and the colleagues, go for diabetes, work for, and the hospitals are coming up on OPD basis. You can have the clinic separate 9 to 5. So diabetes, the best opportunity.
I think based upon how things are going wrong in the world, the number of diseases that are growing
Yes.
every day, I believe PSM is one of the most growing branches.
For sure.
What do you think is the future of this branch in the upcoming 10 years?
Sir, upcoming 10 years, what I feel is, it's more about the lifestyle which is changing. So what we say is, there are something called as primordial prevention, primary prevention, and secondary prevention. I'm not going into the next level, because treatment, complications, progressions, I'm not touching that. Primordial prevention, primary prevention, it's more about the risk factors. You can open a clinic separately, saying that how to reduce the risk factors. I have seen people becoming more health conscious nowadays. It's not just about the risk factor part, it's before the risk factors only. There is a thin lean individual will be coming and asking me, sir, I don't want to become obese. Maybe that time will come. It's now, maybe the obese individuals will come and ask for what I have to do to reduce my weight. 5 years, 10 years down the time, I'm sure that a thin lean individual will come and tell, I don't want to become obese. Maybe that's where PSM plays a major part, preventing the risk factors, primordial prevention, yes, health education parts, maybe through social medias, maybe new, whatever the influencers or whatever, they will be focusing more on the primordial prevention part and primary prevention. With risk factors, what I have to do. So these two things will play a major part, so that as an educator, you are having much of an influence in the society, because you're changing the risk factors or you're modifying the risk factors. Then coming to cancer part, because what I am feeling is, cancer will increase for sure. So the screening part will come. So screening also will need PSM experts. So as the screening part going into the community, how to bring them, how to create awareness, how to reduce that lag time, because the disease initiation to disease progression, there is some lag time. How to reduce that lag time, how to create awareness, maybe that part will take a major turnover in the future, because cancer detection as early as possible, that will be the main landmark in the future, because the progression is very high in the cancer part, what I'm telling this.
Boss, you were talking about that, how important college is in this particular field.
Yes, sir.
So can you tell us 5 best medical colleges for this branch in our country?
So first, MAMC, AIIMS, JIPMER, then comes, I think, Grants, Mumbai, and CMC Vellore. So MAMC, AIIMS, JIPMER, CMC Vellore, and Grants, Mumbai.
Is there any possibility of DNB or diploma in this field?
So there is something called as diploma in public health, but as of now, getting into MD PSM is the best option. Diploma or DNB, just it's an add-on. What after MD, then only it will help. So better have the foundation. You will be having so much of MD seats rather than going for MD seats. If you are taking diploma in public health or DNB, it's almost nothing. Like, it's a nil factor. What I wanted to tell directly. Go for MD. There are so many MD seats. But yes, when you're selecting MD, very good college is very important, and the decent enough college is also fine. Peripheral colleges, no. No DNB, no DPH, MD from a good college, very good scope.
What's the core difference between MD PSM and MPH? Can an MBBS student think of choosing MPH also as their future?
Yes, sir. But as of now, there are so many MD students in the field. So once you're giving your CV or resume into the interview, MD in India, yes, there is so much of scope. And if you want to work within our country, MD will help. And if you want to work outside our country, there are some scopes. There are some colleges. There are some colleges which will hire you as a professors. There, they will prefer more of MPH. And MD with MPH, if you are doing, it's a very good option. And within our country, we prefer MD students rather than just MPH students.
In the work culture, what is the core difference between MD and an MPH?
So work culture, once you are entering into the team, it's almost same. It's depend on the projects and what you're working for. And yes, once you enter into the team, they'll be training you before like 1 month or whatever the pre-training will be there. And once it is almost same because they want the same work culture, same work ethics, same work environment. So it won't be much of a difference then.
Is there any scope of MPH in our country?
As of now, it is very less.
Very less.
Yes, because you are competing with MD PSM, maybe they'll prefer MD PSM over MPH. In our country, I'm telling.
And what's the reason that abroad people are preferring MPH?
So there, the academic part is slightly different. So MPH slight favor compared to MD PSM because the academic whatever training in MPH is slightly related to international parts also, and the academic part, if it is slightly different, they'll prefer MPH over MD in the outside sector, I'm telling.
For an MD PSM graduate, what are the possibilities abroad? Like what work they can do? Is there any good possibilities abroad in countries like UK, US, Australia, maybe other parts of Europe? Is there any good opportunity there?
Yes, for sure. Like if you are going into the development sector, sir, like NGOs, as I already tell, and NGOs, they'll be having projects here also, and they'll be having their projects there also. Once you are working with them here, and once they feel that you are working in a proper way, obviously they'll take you to the other countries and they'll make you work there also. So, and again, the pharmaceutical industries and the vaccine industries, when they are doing research, first and foremost, you'll be getting an exposure in our country, and obviously they will take you to the other countries and they'll make you work there also. There are opportunities, especially in NGO sector and the industry like vaccine sectors, pharmaceutical industries. Yes.
Now we come to the most asked question, most demanded question of our podcast. Was how much can an MD PSM earn initially after becoming an SR, after 10 years, and in the late 50s?
Yes.
Early 50s, I would say. And both in the government sector and in the corporate sector.
Like in the academics part, if I'm telling, a PG PSM may be ranging from 50,000 to 1 lakh, maybe slightly 1.2. I've come across 1.2 also. PG PSM 50 to 1.2. Then once you are doing SRship, it is 1.5 to 2 lakhs. After finishing SRship, an AP, yes, 2 to 2.5, and it can increase like 50,000 for a professor. Like it can go till 3 to 4 lakhs. Sir. That is for academic section. And once you're going into the epidemiologist part, it's almost around the same thing, like 1.5 to 2 lakhs. For that, you have to finish SRship first, 1.5 to 2 lakhs. Then going into the pharmaceutical or vaccine industries part, you will be getting around 2 to 2.5 lakhs. And in the international organization, it can change. It can reach around 4 to 5 lakhs also. Once you're working for other organizations like UN, WHO, it can change. It can reach 5 to 5.5 also. That depends on your work experience. So the overall, if I'm telling PG PSM, minimum 50,000. And till international organization, max 5 lakhs, 5 to 5.5 lakhs. And in the future, maybe once you are around 50 years, 55 years, it can change. I don't want to predict that much as of now. As of now, it is the minimum 50,000. And on an average, if I'm telling proper, like 2 to 2.5 lakhs. On an average, if you're working anywhere when you're landing, after SRship, around 2 to 2.5 lakhs.
Today, even if I talk about, students are still confused whether to take SPM and how should they judge a good college. You are basically telling us earlier that students should only choose a very good central college or a good state college, not to choose periphery.
Yes.
Now, if a student has multiple options, how would you help them out? Like, what are the key parameters a student should look at before choosing a college?
Sir, what I tell is, college in the sense, first and foremost for PSM or any other pre-paraclinical subjects, the city is very important. Metro cities, what I ask, like Delhi, Mumbai, Bangalore, yes, but usually Delhi, Mumbai. If I'm telling it, it's Delhi, Mumbai. The reputation is good. So whenever you're putting your resume into the things, like they'll be seeing from which college are you from. Delhi, Mumbai. First is the place. As the metro cities, the exposure is more, because you'll be attending more and more conferences, and you'll be getting more and more links through the projects and all, and you'll be working for the projects. Usually Delhi, Mumbai, they favor a lot. And the second thing is academics part. You should think like how many seminars they conduct, how many conferences they go for. And the third thing is, what is the research part and the analytics part in that department, how much fellowships, like how many are linked to that, like how many PGs are doing fellowships related to that, so that the overall exposure matters a lot. So first is city. Second, what I'm telling is the fellowships related, and whether the exposure is more or less. It's more or less, the already the names are there. Like Delhi, Mumbai, if you take, it is good. In the decent enough, like other cities like Kolkata, Bangalore, these Kerala will come under decent enough. But in the periphery, I have very less idea as of now, because there are so many medical colleges in the periphery. From my knowledge, it's about the city. Go for the best colleges in the metro cities. That is best. Simple.
Boss, what would your advice be to a new student who has just joined their MD PSM? Your advice to a new JR1?
Sir, it's very simple. Like when you're entering the medical colleges, first and foremost, as a PG, you should be doing the thesis part. So select a very good thesis subject. If possible, go for a clinical trial if needed. So if you are doing a thesis on some clinical oriented things, the exposure will be better. And the second thing is, go for the PARC. Again, read line to line the PARC and select the textbooks what you are supposed to read. First, make the content ready and then work on it. So that is the second thing, is the content part. And the third thing is, start doing some fellowships. As I always say, is do some fellowships related to management also if possible, or some clinics related, so that in the future you'll be having that all-round diverse opportunities, so that you can go either other. Like the options will be more. So first thesis, select a proper thesis subject, then select all the proper fellowships what you are supposed to do, and get the content ready. Like these are the contents which I'm supposed to do, and work with a professor, like 2-3 professors. Yes, just keep a proper rapport with them, so that whatever the projects they are going, just keep helping them, so that you'll be learning the things more practically. In the future, when you are attending the interview, whatever they'll be assessing is whether you know things practically or not. That you'll be learning in the field. Better make some proper rapport with the professors, work with them, learn from them, learn the practical things, what I wanted to tell.
What would your advice be to, of course, a JR1, how to build up their CVs from day one for the best opportunities in this field, whether in India or whether in abroad?
Sir, as a GR1, like if you are putting a CV, first and foremost thing what they'll be asking is, what is your thesis topic? As I told, so first select a proper thesis topic based on the research. Go for the recent trends, like go for something related to cancer if possible. That is the first thing, because in the future the scope will be more. And the second thing is, the research fellowships will be there. So the management fellowships will be there. Try to get into that. And the third thing is analytics. So you should be more good in Excel, handling the analytics. So get that fellowships ready. And the language, try to learn French and Spanish. So this will help in the future to get your CV ready. So once you are finishing the PG seat, you are almost ready for getting into the international organizations. They'll be asking for your CV. So keep applying that. Keep trying. Once and foremost, you'll be reaching the destination for sure.
Boss, what do you think? What is that strategy for that 1% doctors who have managed to create a very successful lifestyle for them? Other than those people who have
Yes.
struggling for 10 to 15 years of practice and yet have not successfully, made themselves something. So what do you think is that particular strategy?
Sir, what I have come across in that 1% what you are talking about is, they have something called as vision. They will be imagining themselves maybe 15-20 years later, whatever the 1% I'm talking about, they have that vision that maybe 15-20 years I'll be there, I'll be doing this and all. That vision comes with something called as process, purpose and passion, what I tell. You should be knowing what you are doing, process, purpose, why you are doing, and passion, whether you are enjoying it or not. So the vision is fueled by these 3 P's, like what is that? Process, purpose, passion. Then comes the hunger, because sometimes you'll feel that saturation point. So daily you'll be having breakfast, lunch, dinner. That is something like physiological hunger in the profession. Also we need that, because saturation should not be the point. And once you reach that saturation point, whatever you have reached, the graph will show in the negative pattern. So it's the vision, then that is supported by the hunger, which is very, very important. And that last thing what I tell is hustling every day is very, very important. It's not easy, because you want to be that 1%. That means 99% will not be doing that. That is what I am thinking about. 99% is not having that, whatever, like hustle, that struggle every day. Whatever struggle can be physical, mental, or some extra influences which can happen around you. So these things you have to balance out. It's not easy. You should have that vision, you should keep that hunger alive, and that hustling, that attitude of getting every day, and I have to do something better for myself, or whatever the profession, I have to take that graph higher, because there is something called as resistance point. And once you reach that resistance point, it's very difficult. And but to cross that point and to go to the higher end, it needs hustling. So 3 words, as I usually say: vision, hunger, and hustle. So 3 words, yes, that will make the difference, 1% from 99% maybe.
I actually have a very personal question now. Personal as in that this I always felt when I was in my own medical college. So when an MBBS student enters their 3rd year, the problem is that they have 2 subjects, ENT, Opthal.
Yes.
Now they have FM also, but in my time it was ENT, Opthal. And then there is PSM.
Yes.
Now 2 clinical, 1 slightly non-clinical.
Yes, good.
And suddenly you see that there is a huge difference in the work culture of all the 3 departments. Now when we go to PSM, we find it boring. Now I'll be very frank here. It is boring.
Sir,
You know, in our college, it was like when you open Park, it's like a newspaper.
Yeah.
Every page has a new news every day.
Small letters.
Yes. And you have to mug up so much.
Yeah.
Now, what would be your advice to a 3rd year student how to actually enjoy PSM?
How to enjoy PSM in the sense, first of all, you have to survive the subject. Rather than telling enjoying, first you have to survive the subject. It's about the survival. So do one thing, like you have to pass this subject first. So what I have to do to pass this subject? And in the future, PSM is very, very important at an MCQ level, because you have to crack the PG exams. So think that this is the only subject which can be the game changer. If you know PSM, you will not get PSM. That is my usual goal when I start teaching. If I'll be telling this, if you know PSM, you will not get PSM, because most of the students will come and tell, sir, PSM is very difficult for me. Listen, the subject which you hate the most, can haunt you for the life. I'm telling, it's not for me, maybe it may not be, but I always say this: if you know this subject, you'll not get this subject. So don't hate this. First of all, no matter, at least you're having some feelings. Some students will not be having any feelings. Some students will be directly telling, I hate PSM, sir. I'm very happy for that, because you're having some feeling. Usually everything starts from hate only. So once you're hating that subject, then later slowly you'll be finding the reason why I'm hating this subject. So without any feelings, you'll not be finding that reason. You'll be finding why I'm hating this subject. Textbook is not that good. Teachers might be boring. Just attendance part, if they're coming, yes, no, just proxies or whatever is going on in the college. Simply you're running through the subject. Better go for the textbook. Highlight the important things. Highlight the PYQs. First, learn why I want this subject. First, you should know the purpose. Very important game changer for PG exams. That may be the motive for you to read PSM in UG level. Once you start reading, it's not that boring also. It's not that boring. I've seen students telling, sir, I was not knowing that PSM is so much interesting. I have seen students telling that, because they know what they are reading. At least they will understand what they are reading. And slightly in the future, maybe step by step, once they pass this subject, or by mistake, if they meet someone who is very good in teaching PSM, by mistake if I'm telling, and if they get all these overall the subject, yes, it will balance out. Later you'll feel that there is something called as PSM in MBBS. It's not that you'll be forgetting this subject. Either you will hate it or you will love it. You'll be having some feelings. That is more important for a PSM teacher. I want you to have that feelings, because I respect feelings, emotions. Maybe I'm feeling or emotional guy, whatever. If you are know me, you'll be coming to know that.
I love that.
Yes.
If you know
Hates or
PSM,
no.
you will not get PSM.
Usually that was the tagline when I started teaching. If you know PSM, you'll not get PSM. Then suddenly students will come to know that yes, there is something I should like that. Slowly they'll develop positivity in that.
In the upcoming next exam, one day that exam might be released. There's a huge chunk of questions of PSM. Now, what would be your teaching style for next, and what is the current teaching style for NEET PG? What are the changes that this subject will have in its curriculum?
Sir, curriculum wise, as of now, we are teaching Park. So that is the basics. What I have seen is most of the questions, around 80% question comes from Park only. So it's more about like whatever the paragraphs or the flowchart oriented things. In the future, if next comes, they're focusing more on clinicals. So PSM, yes, the clinicals will take over in the sense the PSM part of clinicals like communicable diseases, health programs. And when you're integrating with that, like nutrition will come. So then all these clinical topics will be integrated with the clinicals, so that what you are doing is from your side you'll be focusing more on prevention part, detection part. From their side they'll be focusing more on treatment part and the complications part. So what I feel is this subject, yes, we'll be having questions on research, we'll be having questions on flowcharts, analytics, stats or whatever, but more towards the clinical. So communicable diseases, non-communicable diseases, nutrition, and even MCH, Ops Gynae part, all this preventive part will take over the questions. The chunk of questions will be more towards the clinical and integrating this with the clinical subjects. So that will be the main change, like what the next pattern is talking about.
So can you give us an example, boss? Like today, PSM also gets some single liners.
Okay.
In the upcoming time, I have read the next curriculum when it was previously launched. They have put PSM as a complementary subject to all the other clinical subjects.
Yes.
So there must be a difference in the style of questions and the type of questions that will be asked. Can you give us a couple of examples?
Sir, for example, in tuberculosis, they'll be telling like what we use in intensive phase, what we use in continuation phase. That is the first thing. But in the future, what they'll be doing is they'll be giving a clinical scenario for you, like the TB patient is presenting such and such. Like they'll be starting from silicosis, for example, then they develop tuberculosis. They want you to know the occupational health part also. Then they want you to know the disease per se. Then they'll be telling like what are the things you'll be doing, what is the next course of management. They won't be asking directly the treatment part. They'll be telling how you'll be managing the patient. Step by step, they'll be asking. Like you'll be, yes, starting with the diagnosis part, like whatever CB-NAT is there. Second thing will be ruling out HIV in that patient, yes, because you'll be doing cross-referral screening. Then you'll be starting the treatment part, and they might add the follow-up part also. Follow-up is also very, very important as a clinician. So what I feel is starting from diagnosis or any other disease to be ruled out, like cross-referral HIVs, how to start treatment, and maybe they'll be putting the follow-up part also. Like you'll be starting from the patient, you'll be ending the patient with full stop, in the sense you'll be curing the patient, and that whole procedure they'll be asking in a sequential manner. It's not just about one liner. The more about orientation, it's more about the sequence part, what the examiner will be focusing more on.
Actually, that's a very, very good example, and that is showcasing how the mentality is changing in the examiners also.
Because students also know everything nowadays. You want to filter the students in the sense, I want you to put that questions like stepwise 1, 2, 3, 4 or 3, 2, 1, 4 Karodpati like questions we have to put, or else we have to make them learn like UPSC pattern, like which is 1, 2, 3, 1, 2, why not 1 is wrong, why 1 is, like slowly we have to bifurcate. It's about the students, because I have seen students knowing each and everything. Then you have to bifurcate, you have to give percentile scores, then you have to change the pattern, you have to bring some different pattern. That's because you are assessing the students, their cognitive level, their application part. As schooling has gone to next level. So small students, they know everything. Like they'll be taking their mobile phones, they'll be scrolling everything. A 3-year kid or a 4-year kid will be knowing what a 10-year kid was supposed to know. So that has changed a lot. So obviously in the future, if you're becoming a doctor, you'll be knowing and you'll be understanding things in a better way. And if everyone is understanding, I want to focus who is rank 1, who is rank 2, who is rank 3. I have to change my pattern of asking the questions. I have to touch that part which is not being like used by most of the students. That will be the more about the computation part. Competitive exams needs different level of testing. So the questions will change for sure.
Boss, what are the major difference in the question pattern and style of questions in INI-CET and NEET PG currently? of SPM?
Sir, in INI-CET, they'll be asking three patterns like match the following, they'll be asking, sequential, they'll be asking, multiple true false, they'll be asking, in between one-liners, they'll be asking. But in NEET, most of the times they are restricting themselves to like true except, all except questions, and they are restricting themselves to match the following. Sequential part, maybe it will come in the future, they will be adopting this into that only. But as of now, it's more about match the following types and all true except, all false except. They are playing with the words most of the times.
Boss, NEET PG is now around the corner, some couple of months left. So what would be your advice to all the students who are going to attempt the exam? How should they basically revise PSM?
So PSM, as of now, you should be having proper content which is balancing both quantity and quality. Sometimes what we feel is we'll be in between, like you'll be taking a short course or you'll be taking a long course. Maybe short course because it will give that comfort level for you. Long course because you will not be having that FOMO because you'll be covering almost everything in front of you. You'll be having that. Whether you will read it or not, that is secondary. But in front of that, you'll be having that content that I'm having almost everything. But this side will be having a very small content and will be having that comfort level saying, aram se I can revise this. That feeling will be there. Most of this time students will be stuck in between these two things. Once you're selecting some like content, it should be having the mix of both. Not fast food types or not thali types. It's something like the rice, dal, pickle, curd, whatever which is satisfiable for you, not more, not less. That is the first thing. And for any subject, you have to give at least 3 revisions. So plan it out, 3 revisions. The second thing, don't have that feeling that I don't know this subject. Most of the times everything happens in the mind only. So don't have that feeling that I don't know this subject. This subject keeps haunting me. Maybe it was haunting in your UG days, but not in the PG days. You know this subject. Yes, that is enough to crack any MCQ which comes from this subject. Have that feeling, maybe that feeling of I know something can create a difference of 2 questions in a subject. So every subject, 2 questions, just having that feeling, I know this subject, overall 20 to 25 questions, maybe that will be the game changer for most of the PG aspirants. And that is what is happening, because I've seen students telling directly, sir, this subject is weak. So don't have that mentality, this subject is weak. There is nothing called as weak or strong. You should know the basics. You should know the concepts related to that subject. Have that feeling, I know something in that. Not that I know everything. Nobody knows everything. Even the subject experts will not be knowing everything about that subject, but they know what is important. At your level, you know what is important because that is being taught by the teacher. And if you know that, and if you have confidence on you, first of all, not on the subject, that is very, very important. If you know that, yes, I know something, that can create a way for you and that can take you from that barrier, and that is very, very important.
Thank you, sir. That was again very insightful. Now, boss, we move to the last question. Yes. I'm pulling you out of the NEET PG world.
Yes.
And I'm again going to come back to PSM as a branch. Okay. As a medico, as a teacher, as an educator, you have seen this whole field for I don't know how many years now. Now, what do you think will be the top 5 specialties,
Yes.
general top 5 specialties in the upcoming 10 years?
So top 5 specialties overall, if I'm taking, it's more about the emergency part or the life-saving part. What I think is from my side, so neurosurgery, cardiothoracic surgeries, yes. And in medicine part, if I'm telling, it's about the emergency. Again, it comes the hard part, cardiac medicine. And then what I feel is intervention radiologist will take over. Yes. Then comes to the orthopedics and ops part. If they are adding some fellowships along with orthopedics and ops, that will be one of the game changer in the future. So life saving, yes, again the fellowships what you are adding, and that can be the top 5 specialties most of the times.
Thank you so much. That was, very concise and I think very precise also. Thank you so much. And now we come to the most interesting part of our podcast, which is the rapid fire. So boss, very simple rules, 2 rules only. You have to speak the truth and you have to be super spontaneous. Yes, no thinking here. Sure. All right, sir. Can we start? Perfect. So if you weren't a doctor, what would you be?
A cricketer.
One thing you can't live without.
Desserts. I love sweets, so maybe that is the temptation which it's very difficult for me to control most of the times, and I keep gaining weight, but I keep doing that. That is what the balance between the temptation and myself.
Favorite vacation spot?
Favorite vacation spot, like I love beaches.
What's the most adventurous thing you've ever done?
Midnight trekking we did once in Mysore nearby hills. So we started trekking at 11 in the night, and we reached the top of the hill by 4 a.m. So that was the most scariest thing what I have done.
Your favorite season of the year?
Winter,
How would you cure a bad day?
workouts, sweating,
Happiest
running.
moment of Dr. Shetty's life?
First day of my class and first day of teaching PSM for my students. That was the happiest day because that was the day which shaped everything for me. That is the first and the most happiest day of my life.
Thank you so much, boss. I believe you have given us a very insightful discussion about PSM. I think there were so many gray areas where you have now put black and white. And I think every student who was confused about PSM or how to study PSM has now super clarity what this branch is all about. Thank you so much for that.
Thank you so much, sir. Thank you for inviting me. Thank you for letting me know that people like what is PSM about and what I am into like. And thanks for this opportunity. This is my first podcast and I'm really privileged because the only grand test what I have given in my life is Bhatia's, and the first podcast what I'm attending is Nachiket Bhatia Show.
Thank
And
you
I'm
so
really
much.
happy for that.
Thank you so much. Thank
sir.
you so much. So, guys, I believe that today was a very insightful discussion. Everything clear about PSM. No more gray areas. And please forgive me. I keep, saying PSM, SPM again and again. But that's how we were raised. So, I believe whoever was any friend of yours or maybe you, if you were confused about PSM as a subject, if you should choose this branch in your future or as your future postgraduate branch, I think you have all the answers. Now, before you leave, please do not forget to subscribe the channel. Who do you want the next guest to be? Please put it in the comment section. And one more help that you can give me is the personality or the guest or the faculty you want it in the hot seat. Please put a message to them. Please ask them that I will be honored to have them as our hot guests. And this is the only help I require from you. Apart from that, you have to subscribe the channel. So please share it, like it, share it with your friends. Spread the positivity of PSM everywhere. It's a beautiful branch. Do not be confused. Thank you so much and all the best.